Welcome back to Good Day State Line. Angie joining us this morning. We're talking about healthcare. She's from Healthcare Solutions, and we're going to talk a little bit about the real cost of insurance this morning, correct?
Correct.
So for anyone who maybe hasn't seen you before, tell us a little bit about what you do.
Well, I work with Healthcare Solutions team. They're based out of Lombard, Illinois. However, I'm in 14 different states.
Yes.
So I sell health insurance all across the United States. But mainly, people need to know what their costs are. And the average deductible that's being sold on the Affordable Health Care Plan is $10,000. And that can be a lot. What does a $10,000 cost mean? Well, pneumonia, you're in the hospital. Or what about a heart attack or a stroke? So what I do with my plans for my privatized health insurance is I sell for clients accidental or critical insurance. If they fall and break an arm, that coverage is covered right away, right out of their insurance. And I sell for all the major medical insurance companies, Blue Cross Blue Shield, United Healthcare, National General, Aetna, Cigna, to name a few. And so people do not realize that they're paying, as much as a mortgage payment for their health insurance. And I help them customize that, and hopefully I can save that family, 50% of their health insurance.
And that's so important.
It's important, and also I sell to small businesses, the mom and pops, the coffee shops, the local garage owner that, services cars. Somebody that is just out of school and they're dropped off of their parents. It's like a $120 policy, and then they have major medical, and then it's not going to be such a big cost. So, and that's what I do.
We especially love the fact that when you give Angie a call, you're actually going to be talking to Angie. That's such a big, important part of this, because a lot of people don't understand healthcare, and that's where you come in. We have our own jobs to understand.
Right.
You understand yours.
Right, and we're licensed and bonded and insured agents. We understand when the market is changing.
Sure.
Right now we're still in OEP 2, which is Open Enrollment Plan 2. So if you lost your job, you do not have to pay for COBRA at, $2,600 a month. You might be able to go to a privatized plan of $300 or go to the Affordable Health Care Act. Maybe it's going to be free. You're going to get a lot of subsidies. However, you can make your mortgage payment or your rent instead of paying for so much insurance. And then I'll add the dental and the critical in there for you. So it's good to understand and look at that bill on your, taxes and understand that there is ways to save money on that and still have major medical coverage with big term companies.
Yeah, and I think a lot of people too, you get your health care offered to you from your job, and you just accept it. You just click one, but you actually don't have to, right? You can just reach out to someone like you.
Absolutely. So if you're a small company and you're working with a small firm and they're only offering 25 or 50%, but you're still paying $700, you might be paying for somebody in that small company that's had renal failure or Crohn's, where you might be able to say, hey, I want a higher deductible, I'm healthy, I'm exercising, and we'll add dental and critical and still cover you for your full cost of your health insurance. So we want to make sure that that is something that we also address.
Yeah, so anyone can call you, even if right now they currently have insurance. You're a great person to call to figure out what we should be having. Real quick before we go, just mention about that open enrollment. When does it end, this new open enrollment?
Well, it ends next month.
Okay.
May 15th, and we want to make sure that we look at your policies. If you do qualify for the Affordable Health Care Act, you're a sick family and you need major medical costs or you have no income, we want to make sure that you get that insurance before May 15th. But if you're a healthy family and you're spending too much money and you need to cut costs, I can look at your policy and just give you advice on that.
I love that. We love that so much, Angie. How do we reach out to you?
Well, you can call me on my cell phone, which is 847-949-7500, and at my email at aweingarten@myhst.com.
Perfect. Thanks for joining us this morning.
Thank you so much.
In just a minute, producer Danica and I are talking with Chef Liz Rogers, the creator of Creamalicious Ice Cream, and her unique flavor combos and why inclusivity is so important to her company. But first, it's time to name our fan of the week. So next Saturday is National Siblings Day, so we thought we'd get a jump start by asking you on Facebook to share a photo of you and your siblings. And to tell us about it, our winner this week is Cheyenne. She said she has one sister, Eva, and one brother, David. Cheyenne won a GDS swag bag packed with goodies, and you can win next week. Just follow us on Facebook for more details. We'll be right back.